In this lesson, we're going to talk about abuse. And I just want to give you a heads up. This lesson's probably going to be a bit heavy. It's not going to be as bubbly as we try to be, because you need to understand the importance that you're going to play for your patients when you're dealing with abuse. Abuse is a violence or cruelty towards another person. It usually has to do with power or control. It's the way that the abuser exerts their power on that person, and it affects all ages and genders. It doesn't discriminate, and it runs this gamut of physical, mental, verbal, emotional abuse, neglect, extortion, financial abuse. There's a bunch of different ways that abuse works. Now, some cultures don't actually consider abuse as actual abuse, like corporal punishment for one. So spanking is considered part of discipline when it's actually abuse. And the biggest takeaway from the day is you need to understand what your role is as a nurse. And we're going to hit some really, really important points before we do that. So let's take a look at types of abuse. Like I said, abuse is not just physical abuse. It can be mental abuse. It can be emotional abuse. It can be verbal abuse. It could be a combination of these things, but we're going to see kind of who it affects. So your elder abuse, these are your geriatric patients, your older patient population. These are your patients in your nursing homes and your skilled nursing facilities. Some of your older patients that are just kind of maybe they're frequent flyers in the hospital. These are going to be your patients that are potentially subject to elder abuse. Child abuse is another one. When I would float to the burn unit occasionally, it wasn't uncommon to see kids that had been intentionally set in scalding hot bath water as a means of discipline. That's not discipline. That's abuse. And they would do, the adults would do it intentionally to discipline the toddler. And there are some textbook classic signs that we're going to talk about a little bit later that you're going to pick up on, but neglect is also a form of child abuse. Just because they're not being physically abused by an adult doesn't mean that it's not abuse. If they're not caring for them, and they're not bathing them, they're not feeding them, if they're not offering them fresh water, that's a form of child abuse. Sexual abuse is another one. So we're talking rape, sexual assaults. These are all different types of abuse. Domestic violence is another one. There's also a lot of research on domestic violence. But one of the important things that we're going to talk about a little bit later are the different types of interactions between the abused and the abuser. One that you need to pay particular attention to is patient abuse. So nurse patient abuse. This is why we talk about restraint so much, right? So there's a restraint lesson. Please go see it so that we can make sure we're not abusing our patients. But the thing here is overexerting your power as a nurse in an attempt to restrain a patient. That's flat out abuse. And unless you have a solid, legitimate reason for restraining that patient, like maybe they're threatening to hurt themselves, or they're threatening to hurt you, or they're risk of pulling out a tube, you need to make sure you allow them as much freedom as physically possible and figure out other ways to manage them. Just because you can exert your power doesn't mean that you should. And when nurses do that against patients, that is patient abuse. I think it's also really important to talk about the signs of abuse. We can say about what we need to do for patients that are abused, but if we don't understand the cues or pay attention to the warning signs, then we're going to miss something. So let's go over these. And this isn't like an all-encompassing list either. There are more than this. The first one you're going to see are physical injuries. So broken bones or cuts or bruises in different stages of healing is a big one, especially in kids. These are like kind of telltale signs. Typically like circumferential bruises. So like on an arm. So like this is your patient's arm. Like if you see like bruising like this, that like indicates that they've been grabbed. That's kind of a telltale sign for different types of abuse. Sexual abuse, like if there's bruising, unexplained bleeding, bruising around the genital areas, stained blood-stained underwear, those are telltale signs of abuse. Another one is sudden change of behavior. So if you have family that says they've like the past couple of weeks, they've just had this sudden change in their behavior and how they act, like that would be something to say, hey, I have a question about Is there abuse going on at home? So pay attention also to how they act around other people. If you have a patient they're super talkative and they're like, hey, yeah, and they're all bubbly, and all of a sudden that one family member walks in and they shut down, you should be getting that light bulb moment, right? That thing should be turning on, because you should say, hey, look, I'm seeing these physical injuries. They're talking about these sudden changes in behavior. They're nervous around these people. These are cues for you. Another warning sign of abuse is going to be your direct report of abuse. If you have a patient that comes to you and says, I'm being abused, they are hitting me, they are assaulting me, they are raping me, they are doing any one of these things, that is a sign. And that is something that if you need to go to the right people for, and we're going to talk about that a little bit later, but make sure that if they tell you they're being abused, take it for that they're being abused. And you need to report it to those right people. Also, make sure you're paying attention to signs of neglect. Like if a patient has wounds that don't look like they're healing, or they look malnourished, if they look unkempt, if they look like they're not showered, diaper rash. Look, I've got 2 kids. I understand what diaper rash looks like, but I also understand that severe diaper rash where there's open sores, that is not normal. That's a sign of neglect, and that's a sign of abuse. So make sure that you're paying attention, especially like if you're in peds. Like, that's why you'll often see the doctor during or a healthcare provider doing a physical exam on a patient. They'll take the diaper off and they'll look. And the reason is they want to make sure that we're make sure that all skin's intact. We're also making sure that the child is being properly taken care of. So what do you do as the nurse? First off, your assessment is imperative. Solid health assessment. You're going to check your skin. You're going to look for injuries. You're going to pay attention to what the family member or what the patient says about family members. If the patient's a child, watch those interactions between the parent, adults. Watch your parents or adults or other people in the room that the child may change their demeanor around. Also elderly patients. Elderly patients are happy talking. They're bubbly, and all of a sudden they have that one family member that comes in, or that one caretaker, and there should be just pay attention to those. Be objective. So that's another one, right? So don't go out and just because you have a suspicious injury, that shouldn't be like, oh no, they're being abused. Don't take it as that. Just say, okay, I need to investigate a little bit more, because if you start being biased, you start to look at stuff through a different type of lens, and you can't be objective. So just watch your interactions between your patient and your other people, and pay attention to the patient's nonverbal behavior. Mandatory reporting. Here's a big thing right here. In cases of child abuse, you are 100% required to report it, even if you suspect it. And in elder abuse, you also are, in most states, are required to report it. But before you just hop on the phone with 911, make sure, find out what the policy is where you're at, talk to your charge nurse, your providers, figure out what the policy is in reporting it. Just know that you have that responsibility to report. It's going to vary by state. It's going to vary by facility. Domestic violence is not required to be reported, but there's some little nuances with it. If we think a crime has been committed, in using a weapon, then it's a crime and you have to report it. But the best thing you can do is talk to your leadership. The next thing you need to focus on is building trust. I cannot begin to tell you how important this is, because of, if you don't have the trust for that patient, they're not going to be honest with you. If you're honest with your patient, and we talked about this in another lesson, if you say you're going to be gone and you're going to be back in 5 minutes, be back in 5 minutes. When you build that trust, you build a rapport, you build that relationship, and then that one nurse they didn't want to talk to about their abuse, they may feel comfortable talking to you about it. So build a trust, work on that relationship with that patient. Just the other thing you never want to ask them is, don't ever directly ask them if they're being abused, because what it does is it puts them on the defensive. So you want to say, hey, do you feel safe at home? And then you can start to navigate the process like easily. Like, don't probe them, don't accuse them, and definitely don't blame them. And also use your therapeutic communication. Just work on building that trust, communicate with them, be caring, give a damn about your patient. Also, this guy, provide your resources, provide education. If there's a women's or children's advocates in the hospital or elderly patient advocates, like, get those people and get them to your patient's bedside so that they can provide the right resources for your patient. So for our nursing concept for today, we really focused a lot on patient safety. We also focused on that patient-centered care. And also, because we are mandatory reporters as nurses, we do have ethical and legal implications, and it plays into our legal practice. Okay, so let's recap. Abuse is about exerting power. It can be done. It can be done through violence. It can be done cruelly. It can be done, and it's got lots of ways it can happen. It can be done physically, verbally, emotionally. Verbally, it can be done through exploitation, or for financial gain, right? It can affect all ages and genders. Abuse does not discriminate. Abuse can be domestic abuse. It could be elderly abuse. It could be patient, child, sexual. You need to learn to recognize them and remember the cases that you are required to report. I cannot highlight this point enough. Observe what you see and you are required to report. 100% of child abuse and most cases of elder abuse. If you suspect elder abuse, you better just find whoever your leadership is. Hey, I suspect this. This is what's going on. Are we required to report it? And if so, then and it's going to vary by state, but just make sure that you are required to report those, and make sure that, the best thing I would recommend is, if you suspect abuse in any case, talk to your providers, talk to your charge nurses, talk to your leadership, and report it when you have to, and get those people help. Guys, again, I want to apologize. This was a really, really heavy lesson, but it's really important. Make sure you check out all the resources attached to this lesson to go out and be your best selves today. And as always, happy nursing.